Hi guys, welcome to my channel. If this is your first time, my name's Daniel. If you have subscribed and this is not your first time and you're just tuning in again, thank you very much for coming back. I truly appreciate it. In conjunction of World Physiotherapy Day, today we'll be doing a video on HEPs or home exercise programs. First of all, why is HEPs important? If you take into consideration like how long you see that patient, all right, you see that individual at your clinic, at your center, wherever it may be, versus the duration that they're out there, they are back at home, they're back at work, it doesn't tally. Or maybe like this, it is 1 hour versus 23 hours. 1 hour of your treatment, your, I don't know, it can be your passive movements, your stretching, your manual therapy, your maybe hot pack, hands, ultrasound, against whatever is out there that they are facing on a day-to-day basis. So let's take, for example, a case of low back pain, yeah? So just imagine, all right, a 35-year-old male patient comes in, meet them, blah, 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 you do your assessments, everything, and ratatatata, low back pain. All right, so maybe it's a non-specific low back pain. All right, there's no trauma, there's nothing. He's just having low back pain, and perhaps it's been going on for the past 3 to 6 months. Most likely during the session, he will feel much better. Maybe not much, but he'll feel better as compared to not coming at all. And so you dig a little deeper, you try and find out how is his environment, because it actually takes time to build up a reputation. No, 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 no. A relationship, all right? It takes time to build a relationship with someone because honestly, the first time you meet someone and you ask them personal things, most likely they will not answer. They will hesitate to answer, or they'll just give you a very rough picture of things. They won't tell you in detail. So as time goes on, try and dig up more information on things out there, whatever is going on in that 23 hours that you are not seeing him. So let's just imagine, all right, this patient of yours, okay, so 35-year-old male, low back pain, maybe work is stressing him out, perhaps because of the pandemic, he got a pay cut. Perhaps his diet is also off because he's trying to rush for all this work that he does not take his lunch break. And even if he does take his lunch break, maybe he just have a cup Maggie, Maggie cup, instant noodles, maybe just biscuits or buns. Yeah, the environment will play a very, very big factor on how they perceive pain. For that 1 hour, he's just away from everything else. And this is where your HEPs come into play, your home exercise programs come into play because you tailor make specifically for that one individual. And your home exercise programs, if possible, try to really tailor it to the environment. For example, you want to strengthen the glutes, all right? So most of the time we'll give them bridging, all right? That's the most basic. Just bridge, just lie down on the bed, just bridge up and down, up and down, up and down. Feel the activation, good. But this guy is at work most of the time, so you really have to change the exercises according to their environment, where they are most of the time, and how they can actually do it where they are. Sorry, I kind of drifted off there. It's not really out of topic, but I've been blabbing a bit, so I'm sorry about that. But yeah, in conclusion, you're going against 1 hour versus 23 hours. So we'll try find ways to fill in the gap, fill in some physio sessions between those 23 hours. Alright, and now I'll get into the main topic of today's video, patients not doing their HEPs. It is very, very common that when you see the individual again and you check on them and you ask them, have you done the exercises? They're like, yeah. So you ask them, can you show me what you've done? And then they'll be like, oh, saya sudah lupa, I don't remember. They have not done anything. And because of that, it's very easy for us to conclude that this person is lazy or that they lack of discipline or they don't find that the exercise that we give is fun or engaging. So they just give up. They just don't do it and they just rely on you during the sessions. There are many factors to why they don't do the exercises back at home. And like I said, maybe it's the lack of discipline, the exercises is not fun, it's boring, it's repetitive. Maybe they lack the motivation or because there's no supervision that they just slack off. So in this case, it's very easy for us to conclude that this, and we just blame them, you know. Okay, fine, you don't want to do, you're lazy, you don't want to do stuff, then so be it, you know. A very common misconception in rehab is that patients don't do what we ask them to do is because it's not fun and that they do not enjoy them. And this is very, very far from the truth. Try and change your mindset a bit. Try to look it from a different perspective, from a different point of view. Maybe instead of looking at straight, look from the right, look from the left. Maybe they're not doing it, not because it's not fun or because it's boring, but because they do not understand why do they have to do this. They fail to connect the exercise that you've given them and the outcome that they want, the outcome that you want, and they just couldn't piece it together. So, for example, bridging and no back pain. No back pain. Not low back pain, but no back pain. They cannot connect these two. They just don't see it fitting anywhere. They see it as two separate things. Therefore, it's our job as healthcare providers to bring these two together. Because at the end of the day, people put effort into things that they find important to them. Whether they enjoy it or not, it doesn't matter. But because they find that it's important, they do it. They put effort into it. So that's all for today's video. Thank you very much for watching. I hope you learned something and I hope you enjoy it. Even if you don't find it enjoyable, maybe it's important. So maybe you should put effort into watching my videos, whether you like it or not. Thank you very much. I'll see you next time, somewhere in the near future. Yeah. So, bye bye.